So in my residency program, we used a different system, and I found this system to be so much more efficient and effective. I actually love Epic. I think that it makes it easier to care for our patients, particularly with chronic diseases such as diabetes.
Our electronic health record is called Epic. It enables us to, in real time, communicate information about our patient and document everything that's sort of happening with that person.
It's also a great way of tracking how you're doing because you can watch somebody's progress. You can monitor whether their hemoglobin A1Cs are getting better if they have diabetes. You can track and monitor the response and whether their blood pressures are getting better over time. And we're now going to be able to track and monitor the response to see whether or not the kinds of social problems that they bring to us are also improving over time.
Our electronic medical record creates these reports that are called workbench reports, and they're live to the minute, so they update every 3 minutes, I think. Great thing about this report is that I can run this report and say, well, in the past 3 months, who are my patients with hemoglobin A1Cs over 9% that I have not seen, that I have not come back to clinic. And these are patients that obviously need to be followed up. They have uncontrolled diabetes. So that report will produce the list of patients that I need to outreach.
So if we have someone, just as an example on the mental health side, who is on antipsychotics, part of what we need to do, antipsychotic medication, part of what we need to do is measure their HbA1c levels. We actually have in the electronic health record something called the best practice advisory that pops up and lets us know that an HbA1c level is due for this particular patient because they are prescribed an antipsychotic. So that's just one simple way in which it takes some of the thinking right out of it. We can just use the prompts of the electronic health record.
We have smart sets that have the different supplies that need to be ordered, the medicines that need to be ordered right in one location and place, so that we don't have to look all over the system in order to provide the resources to the patients. Additionally, there's best practice alerts that come up. So if a patient is due for a hemoglobin A1C, that information is already seen by an MA or a nurse prior to me even coming to the room. So that information is already there when I'm able to speak to the patient. And it makes for a more meaningful encounter when I'm with the patient one-on-one because we actually have data to talk to.
What I think is one of the most amazing things about electronic health record is its connection to what we call a patient portal. We have something called My Chart My Health, which is an online website or portal that's a secure portal for patients to have access to their own health records. They can see their diagnoses, they can see their lab results, they can see their appointments, they can make appointments, and they can securely message their providers, which again puts the power in their fingertips and empowers the patients to be able to really be active participants in their health care.
So we tell this patient you need to increase your insulin every day by a certain amount, and they might have questions. And a great way of getting in touch with us is through My Chart. They send us email, we open this chart, we get this email, we can respond right away. It's a great way of communicating. I don't think it's a way of treating the disease itself, but I think it's a good way of coaching patients and help them through until the next visit.
The benefits of the EHR is the fact that it allows providers to really get together, but not in a physical format. It allows us to review the patient's chart, make appropriate suggestions, and also do referrals, and most importantly, provide the patient with the best quality of care needed.